Namaste, I am Dr. Neelesh Reddy, Consultant Medical Oncologist at Columbia Hospital, Bangalore. Over the next few minutes, I will just discuss briefly about the treatment of cancer, its complications, what precautions we need to take to reduce the complications and to avoid the complications. These points are general in nature and not specific. So, from person to person there may be some variation. So, before implementing these points, it is better that you consult your respective oncologist and take the decision. The points which I will be speaking are more of a general in nature. What is cancer? This is one of the commonest thing where it comes to mind of patients who have been newly diagnosed with cancer or who are going through the treatment of cancer. Cancer is nothing but an abnormal growth of a tissue. In human body, every cell has defined its function, its growth, and the duration of its survival is defined at the time the cell is born. But sometimes these normal cells, they define the function, they defy the function and then start multiplying and forget all the functions. They just keep on multiplying and multiplying and multiplying. Then the problem of cancer arises. So, in one word, if you want to tell what cancer is, it is nothing but abnormal growth of a normal cell. Now, coming to treatment of cancer, there are different types of treatment, broadly divided into surgical, medical and radiation oncology. I will come specific to the medical oncology part, which deals with treatment of cancer with chemotherapy. As I said, the cancer cell is the one which multiplies at a rapid rate. So, chemotherapy uses this principle and try to kill the cancer cell. So, chemotherapy works on a principle that anything which is multiplying faster in the body is killed by chemotherapy. There will be many cells in the body which normally will be multiplying at a very faster rate, like the WBC of the body, the cells which line our oral cavity, throat, gastrointestinal tract. So, once the person is administered with chemotherapy, not only the cancer cells are killed, some of the normal cells are also damaged, which results in side effects to the patient. So, what are the common side effects of the chemotherapy? Chemotherapy, since it is administered intravenously, it goes to every part of the body. So, potentially it can cause side effects which can involve any organ in the body. However, from the management point of view, it is classified as those side effects which are of serious nature and those side effects which are non-serious but can have a significant impact in the day-to-day activity of the person. The serious side effects include if the person develops fever more than 100.4, if the person develops diarrhea, that is loose motion, more than 3 times a day and if it is watery, or a person develops severe tiredness in the sense that even to go to bathroom is difficult or to sit up from lying position also is difficult for him, or if they have bleeding manifestations, if they are having blood while coughing, or if they are bleeding from the nose or from the oral cavity, or the place where they pass urine or in the stools. These symptoms are generally considered as of a serious nature and you need to consult your oncologist immediately. But there are far more side effects which are of non-serious nature but can have a significant impact in the day-to-day activity of the person. These include, they may have nausea, some of them can have vomiting, there can be hair loss, there can be change in the taste because of chemotherapy, there can be oral ulcers, there can be change in the skin color, nail color or tongue color of the person after the chemotherapy. They can have effect on the nerves which will result in tingling sensation in the hands, tingling sensation in the legs. They can have effect on the heart which can result in decreased pumping capacity of the heart. They can have effect on the lungs because of which they can have breathing difficulty. It can have effect on the kidney, effect on the liver. So, each and every organ can get affected, but it is uncommon. The common things are like if you have fever, if you have loose motion, if you have tiredness or if you have any bleeding manifestation, you need to get in touch with your oncologist immediately. Now, anything can be done to reduce the side effects. Yes, there are precautions which you can take to reduce the side effects. These include some changes in the food. When you are on intensive chemotherapy, the food what you take has to be cooked. The food which you take is preferably prepared at home. These two things will ensure that the food is hygienic. By making sure that the food is cooked and it is cooked at home, the risk of infection from the food is significantly reduced, so that you developing diarrhea or an infection is reduced. Which means for the duration of chemotherapy, you may have to avoid fruits, you may have to avoid vegetables which are uncooked, you may have to avoid salads. In that way, you can avoid the risk of infection. The other way in reducing the infection is following a strict hygienic measures, like washing hands before eating food, after eating food, doing mouthwash daily, morning and night, and after having food, changing the cloths regularly, taking bath daily. The plate in which the food is served has to be clean. The person who prepares the food and the person who serves the food, if they wash their hands, and once the food has been consumed, the food to be refrigerated. These are the ways in which the risk of infection will be avoided. Other thing is avoiding going to crowded places, because people who have received chemotherapy will be susceptible to infection. You can catch infection from somebody else. Somebody coughs or somebody sneezes on you, you can catch the infection. So avoid going to crowded places. If in home somebody is having fever or running nose, they should preferably avoid coming in close contact with the person who is taking chemotherapy. Similarly, we will have a lot of pets in the house, dogs, cats or any other pet. Preferably they should be avoided in entering into the room where the person who is taking chemotherapy will be staying. Other than these, people who are diagnosed on cancer may be on long-term medications. You may be on your medications for blood pressure, you may be medications on diabetes. Please do inform the medications which you are already on to your oncologist, and most of the times it is necessary that during the treatment you need to continue on these medications. People who are having blood pressure and people who are having diabetes, during the treatment there may be variation in your blood pressure or variation in the blood sugar. These, if you continue on those medications, these variations will be reduced. There are quite a lot advances have taken place in the treatment of cancer. There are targeted therapies, there are monoclonal antibodies which may not cause the conventional side effects of chemotherapy which I just mentioned, but they have some unique side effects. So whenever you feel some symptom is troubling you unduly, it is always better to consult your oncologist so that a solution for that side effects is found. Thank you.